Hi, my name is Anya. I'm going to be your nurse today.
Hi, how are you?
How are you doing today?
Good, thank you.
Okay, so what I'm going to be doing today for you is an abdominal assessment. Is that okay with you?
Yes.
Okay, perfect. Do you have any concerns about your abdomen area? About your bowel movements?
No,
Are you regular in the bathroom?
definitely.
Bowel and bladder?
Mm-hmm.
Okay, perfect. So I'm going to start by assessing and inspecting her abdomen. Right now, looking at her abdomen, the contour seems to be round. The umbilical area, the umbilicus is midline. It doesn't appear to be have any discoloration around it. The skin color is in line with the rest of her body and in line with her ethnic background. Now I'm going to move on to auscultating, and I'm doing this prior to palpating or percussing because it might alter the results. Okay, now with my stethoscope, I'm going to move clockwise. I'm going to be starting by the right upper quadrant. Okay, high-pitched sounds are heard all over 4 quadrants. Now I'm going to move on to assessing the vascular part of her stomach. I'm going to do this by putting the bell of my stethoscope in her abdominal arteries, starting with the aortic artery, moving on with both renal arteries, iliac arteries, and femoral arteries, which will be located down here, but I'm not going to be assessing those in this video. Okay, no worries are heard. Now I'm going to move on to percussing her abdomen. I'm going to do this using both my index and my middle finger. I'm going to do this way actually. And then the 3 fingers on my other hand using the soles of my finger. And I'm going to move on clockwise. And you're going to notice that on the air-filled areas of the stomach, you're going to feel a tympanic sound, while if you percuss around the solid areas of the stomach, like the organs, you're going to feel a more dull sound. Now I'm going to move on to palpating her abdomen. I'm going to use light and deep palpation. Light palpation is going to be around 1 centimeter deep. I'm going to do this clockwise in her abdomen. Let me know if you feel any pain. Okay. And now I'm going to move on to deep palpation, which is about 3 to 5 centimeters deep in the stomach. Do you feel any pain?
No.
Okay, perfect. Now I'm going to move on to assessing her liver. And for this, you're going to put your left hand under the patient's about 12th to 11th rib. And with your right hand, you're going to be palpating the left side, about the left upper quadrant, which is where the liver is located. Okay, nothing is felt. Now I'm going to move on to assessing her spleen. I'm going to do this again, placing my left hand on the 11th to 12th rib. And then my right hand is going to go on her left upper quadrant, kind of pointing at her axillary. Okay, take a deep breath. Nothing is felt, so her spleen is not enlarged. Okay, and if you're, now I'm going to assess for rebound tenderness in her stomach. So for this, I'm going to palpate deeply, and I'm going to assess for the tenderness, or I'm going to ask the patient if she has any pain while I do this. Okay. Did you feel any pain?
No.
I didn't see any rebound. Okay, so now sit up looking that way, please. What I'm doing now is assessing for CVA, and I will do this by placing my hand here and my fist over my fingers. Let me know if you feel any pain.
No.
Okay, patient doesn't feel any pain. Thank you so much. That's going to be it for today.
Thank you.